Good afternoon, everyone. My name is Dr. Athena Ramos, and I'm an assistant professor in the Department of Health Promotion in the College of Public Health at the University of Nebraska Medical Center. I've spent about the last 20 years working with communities to find solutions to common public health concerns. Much of my research has focused on occupational safety and health with vulnerable workers like farm workers and meat packers. I've also looked at immigrant integration in smaller communities and how to integrate and welcome newcomers to town. And finally, I've looked at community well-being and how do you design structures that attract people, create vibrant places, help people to stay healthy, and create a social structure that is built on equity. Today, I'm going to share with you a recent experience that we've had with COVID-19 and the meatpacking industry in the Midwest. So for those of you who may be unfamiliar with what meatpacking is, I wanted to give you a little bit of background about the industry. So meatpacking refers to the slaughter of animals for meat production and other byproducts. There's over 500,000 people across the United States who work in meat processing facilities. Many of the plants, in fact, over half of the plants are located here in the Midwestern region. Meatpacking work was deemed essential critical infrastructure work by the Department of Homeland Security back in April because there was concern over the adequacy of the U.S. food supply during the COVID-19 pandemic. And they wanted to make sure that the plants could remain operational to be able to process the animals. But we know that these plants have experienced large outbreaks of COVID-19, and there's a big concern both among workers and among plant leadership of what to do. For example, in Dakota City, Nebraska, which is home to a large processing facility that employs about 4,000 people, they've seen almost 800 cases related to that one facility and at least 3 deaths. Grand Island, Nebraska, again, they've seen over 300 cases related to the plant. In Colorado, another large beef processing plant has seen almost 300 cases and 7 deaths. Sioux Falls, South Dakota was the hotbed for COVID-19 outbreak back in April, and they've seen 1,500 cases and had a positive case rate of 10%. So this gives you a little bit of background about the importance of this issue, but also about the experiences that they've had with these large outbreaks in the plants. Data about these outbreaks in meat processing facilities is hard to come by. And in fact, many states are reluctant to release such data. But we do know, at least about Nebraska, that as of June 11th, there were nearly 4,000 cases of COVID-19 that were tied to meat processing facilities across our state, and that 14 workers had died as a result of these outbreaks. And we've seen about 170 hospitalizations related to COVID-19. Now, Nebraska is not alone in facing these issues. In fact, states like North Carolina and Georgia and Alabama and Pennsylvania and Iowa, South Dakota, all of them have experienced these large outbreaks, and very few have actual data. So much of the data that we have related to these outbreaks is through the popular media and the press that has been reporting on these issues fairly consistently. Our team here at the University of Nebraska Medical Center has been in a fairly unique position because between April and June of 2020, we have had a team of infection control specialists who has actually been conducting site visits and providing technical assistance to meat processing facilities across our state. Through these site visits, though, the team realized that they were having only a limited perspective of what was actually occurring in the plants because they didn't have full access to all locations throughout the plant, and they didn't have direct engagement with workers. They only had direct engagement with leadership. So the team realized that we needed to have an engagement strategy that focused on workers and communities and organizations that regularly deal with this worker population. That's how my team got engaged with these efforts, because we've been involved for many years looking at how to work with communities to find these solutions and to understand the social networks that exist in communities. So we hosted a number of virtual meetings with stakeholders all across our state. And we wanted to learn more about the situation that people were facing, that the workers were facing, and that was occurring in the community. And so through these meetings, it was suggested to us by the participants that we should do a survey of meatpacking workers to understand and hear their voices directly. So the study that I'm going to share with you today was not my idea. In fact, as I mentioned, this was an idea that came from the ground up. It came from community members to us as an idea that they thought was worth exploring. So we started this study by listening, by learning from the narratives and from the needs that community stakeholders were sharing with us. Now, a study of meatpacking plant workers is no easy feat. In fact, last year, I had conducted a study of meatpacking plant workers, and it was very challenging to be able to recruit for the study. There's lots of reasons why. We only wanted to get 50 people to participate in last year's study, and that took us nearly a year, almost 12 months, to be able to recruit those 50 participants for the study. Some of the reasons why it's hard to reach this population include the geographic isolation of the plants. Many of the plants are located in rural communities, so it makes it easier and closer for the animals to be transported from the farm to the processing facility. Many of the workers in these plants are immigrants, refugees, and people of other minority groups, so there's a culturally and linguistically diverse workforce. Some of the plants have mentioned they may have 20, 30, 40 different languages that are spoken by the workers in their plant. Many of the workers are structurally vulnerable. They get paid low wages. Many are undocumented immigrants. Many have limited English proficiency. There's also a history of exploitation in this industry. So there's been many reports that have documented human rights abuses and labor abuses within the meatpacking industry. And there's large power differentials between line workers, supervisors, and plant leadership. So there's a lot of fear for people to be able to speak up and to speak out about what was happening in their workplace. This made it more important for us to be able to engage partners. So it became critical that we maintain the trust that we have with established partners and build trust with new partners that we were trying to bring on board. We wanted to make sure that we were being very open, honest, and transparent with all of our partners around what our team was doing, what our intentions were, and what people could expect from us. So in designing this study, we really wanted to understand what our partners and what our stakeholders were hearing from workers, what their priorities were for this study. And so we tried to engage them in multiple phases of the study. For example, in designing the study, we asked them to provide feedback on the survey questions, to talk to us if they were about the understandability of the questions, and also just in the nature of the questions to make sure that we were on track and on target with the things that they thought were most important. We didn't want to make any assumptions. Partnerships are a really important gateway for being able to reach vulnerable worker populations. Going into a community or a workplace that you're unfamiliar with is really challenging. And you need to understand the social structures that exist within these places in order to have the trust and be able to figure out who are those partners that have the trust, who are going to be able to facilitate those relationships with community members or with workers that you're going to need to be able to conduct this type of research. So partnerships were extra important in our case with this pandemic because we had restrictions from our institution regarding research and face-to-face contact with participants. Typically, we would have visited community organizations, we would have done public presentations with workers to talk to them about the study that we were conducting. We would have probably made home visits to actually conduct interviews directly with workers so that there was no fear about speaking up because they're in their own home. We probably would have canvassed neighborhoods and provided incentives for participating. But many of these things weren't feasible at this time because of the restrictions and because of the time-sensitive nature of the study that we were trying to conduct. Plus, because of those restrictions and because of those things, we actually had to deal with additional barriers, like, for example, limited literacy, limited technology literacy, because if we can't do face-to-face contact, then we had to do something virtually, which made that quite challenging. And it also brings up additional questions regarding the level of trust that people have when they can't actually physically be with you. And a lot of times in our communities, that physical presence is something that helps to establish relationships. And so without that, it becomes very, very difficult to be able to conduct the type of research that is needed. Our study was conducted between May 7th and May 25th of this year with meatpacking plant workers from across the Midwest, primarily Nebraska, Iowa, Kansas, and Missouri. We wanted to be able to assess their concerns and their perceptions related to COVID-19 in their workplace. Specifically, we sought to better understand how they perceived that their work environment had responded to the COVID-19 crisis. We wanted to know more about the information and material barriers that they had experienced, and also what preventive strategies they may be engaging with outside of the work environment. We created the survey and put it online on RedCap, which is our electronic data capture tool from our institution. The survey was available in English, Spanish, and French, and we promoted it through many different mechanisms like Spanish language media, radio, TV, newspapers. We also boosted Facebook posts and paid for some Facebook posts in English and Spanish. And we worked with community partner organizations to be able to spread the word through the people who they normally interact with. This study was approved by our institutional review board. We had a total of 637 solid records or people who participated in the survey. We actually had about 950 records in the electronic system, but after data cleaning, we had 637 responses that were good to use. Let me share with you a little bit about the demographic characteristics of the people who participated in our survey. We had about 57% of our participants who were females. The majority of people who participated were Latinos, mainly from Mexico, El Salvador, Guatemala, and Cuba. Most had a lower educational level, like high school or less. And about half of the sample, a little more than half of the sample, was limited English proficient. We had people from all different parts of the plant who responded to our survey. In fact, some workers were on the kill floor, others were working in processing the meat after and slicing up the meat. Some were involved in packaging, others were involved in cleaning. But we also had people who were in administrative positions like occupational health nurses or supervisors who also responded to our survey. We asked workers about their health. We wanted to know, in general, would you rate your health as excellent, very good, good, fair, or poor? Normally, this question is dichotomized into two options, good health and bad health. And as you can see, we had about 75% of the participants who rated their health as good, very good, or excellent. We had about 90% of the sample who said that they do have access to health insurance, but a much lower percentage actually reported that they had a regular healthcare provider. We also saw that there were a number of people who reported having chronic health conditions. About 3/4 of workers reported that they believed they were at high risk for contracting COVID-19, yet only about 42% had been tested at the time of the survey. Many people noted barriers related to testing. The number one barrier reported was the fact that people weren't sick, so they didn't feel the need to be tested. To me, this speaks to the lack of information or the confusion around pre-symptomatic or asymptomatic spread of COVID-19. Other people mentioned barriers like being unsure where testing locations were in their community, being worried about the cost of testing, and some felt that they didn't know what to do if they actually did test positive. About 31% of workers reported that someone in their household, or both they and someone in their household had tested positive for COVID-19. And nearly 90% of workers, so virtually everybody, said that they knew somebody who had tested positive, a coworker who had tested positive already. As I mentioned, one of the goals of the study was to understand how the workers perceived their employers had responded to COVID-19 and what were some of the actions that may have been taken by the employers. As you can see in this slide, about 90% of people reported that their plant was taking temperature checks as people were entering the plant. About 83% said that the plant was making sure that everybody was wearing a mask at all times. And about 80% reported that their plant had posted multilingual signage about COVID-19 in the workplace. However, some of the things that make a big difference or that may make more meaningful changes in the work environment, like increasing the distance between workers, slowing down the line speed, or restructuring the shifts, and providing workers with additional paid time off in the need for isolation or quarantine related to COVID-19 were much less frequently reported by the workers in our study. Over 70% of participants in our study reported that they had received some type of COVID-19 information from their employer. Some of that information was related to symptoms associated with COVID-19, safety precautions, hand washing guidelines, but fewer reported that they got information about wearing and caring for a mask properly and about sanitation and cleaning procedures. That still leaves 30% of workers who reported that they didn't get any type of information related to COVID-19 from their employer. Workers wanted information about COVID-19 and how to stay healthy. They wanted to know the prevalence of COVID-19 in the plant and how many people had tested positive. They wanted to know about the strategies that the plant was taking to protect them and what to do if a coworker or they themselves tested positive. They also wanted the plant to emphasize the importance of staying home if a person was sick, and to validate and really promote the policies around attendance that they may have implemented specifically for COVID-19 to help people isolate and quarantine at home without the pressure of potentially losing their job. They wanted information that was language and health literacy appropriate. About 42% of workers mentioned that supervisors were only interested in getting the job done quickly and fast. Many workers mentioned that they felt pressured by their supervisor to come to work even if they were sick and to return to work even before their quarantine or isolation period was over. Workers described the plants to be places that consistently prioritize production over people. On this slide, you'll see a number of quotes that came from the comments that workers left in the survey. For example, they say, they don't care about the workers. They only care about the money. Each person's life for them is just another cow. Aren't we essential workers? They should take better care of us and respect our lives more than money. COVID-19 sparked fear and distress among workers. On this slide, you'll see a number of quotations that highlight this point. Many workers described discrimination or preferential treatment. They shared stories of trying to use sick leave and then being denied or being called back early to come to work. Many workers felt like the plants were hiding information from them and that there was no transparency in the number of positive cases reported by the plant. Many of the workers felt like their employers started to take action too late, if they took any action at all. They also mentioned that the financial incentives that had been instituted by the plants had actually incentivized sick workers to continue to come to work. As you'll see on this slide, one person said that a $30 daily bonus was useful in getting sick people to return, but that was something that actually put everybody else in danger. Participants really wanted the plants to be more active in protecting their health and well-being, and especially they were concerned about the most vulnerable workers among them. Workers described being structurally vulnerable, with little recourse to actually be seen, heard, valued, and cared for by their employers. They felt like elected leadership had discriminated against them because they were immigrants or minorities. And they felt like the plants cared more about production than they did about people. The quote on this slide, I think, sums it up. This person mentioned, "The company logo says that we're all a family. I don't see a family now when we needed it the most. They didn't protect us. Not even the union helped. A one-time bonus doesn't help when we need compassion, not a call stating that you need to come back to work." We asked the workers to give us their ideas, their recommendations on how they could improve the work environment. So this slide is a summary of the most commonly reported ideas. You'll note that social distancing or physical distancing in common areas like locker rooms or cafeterias, hallways, and bathrooms was something really important. The workers also wanted to stagger breaks so that they wouldn't come into as much contact with other people, and make the breaks longer so that they'd actually have time to put on their personal protective gear and make it back to the line on time. They talked about the need for more sanitizer and hand washing facilities, soap. They talked about the need to have more than one mask per day, because in a meatpacking plant, as you can imagine, it's dirty, dangerous, demanding work. There's a lot of sweat, there's a lot of blood, guts, and if you're wearing a face mask, that can get pretty dirty pretty quickly. And so they wanted to be able to change that face mask more than once a day. So when they go to break or when they go to lunch, they could actually get a new one. They also wanted to have more culturally and linguistically appropriate information in the plant and have somebody who can talk them through what was actually going on, not just putting a poster on the wall and being able to check the box, but really taking the time to care for the workers and to help them to understand the severity of what was going on. Now we'll switch gears briefly to talk about some of the concerns that workers had generally. As you can see, about 93% of workers reported that they were worried about bringing COVID home to their families. They were more concerned about bringing COVID home to the family than they were about their own personal health. Only 85% said that they were worried about getting sick themselves. Then we see about 70% who say that they were worried about losing their job, being able to have enough money to buy food and to be able to pay their bills. The majority of workers in our study believed that they were at high risk for contracting COVID-19, and they were looking for their employers to take the lead in protecting and promoting their health and well-being. Workers noted that there had been some changes that had been made in their work environment, but there was a lot of opportunity for more action. They wanted more transparency. They wanted to know about the number of positive cases in their plant and what the plant was doing to reduce the transmission of COVID-19. Workers were worried. They were worried about bringing home the virus to their family, about getting sick, and about having enough money to be able to meet their needs. Reducing and stopping the spread of COVID-19 is not a workplace issue alone, and it's not a community issue alone. This is an issue that crosses both spheres. It's both a community and a workplace issue, and so we've got to have strategies that cross both worlds. Because COVID-19 is both a workplace and a community issue, our team developed 3 key pillars of action. There's action within the workplace, there's action within the community, and there's action around treatment and testing, which crosses both spheres. All of these need to be wrapped in a culture of transparency and equity and trust and reciprocity. So if we look at the workplace, there are some things that should be done. For example, workplaces should be implementing and enforcing the CDC and OSHA guidance that came out for meat processing facilities. Workplaces should be educating and training their workers about how to prevent infection, and they should be providing appropriate personal protective equipment and source control to their workers. In the community, we should be promoting preventive behaviors like wearing a face mask, like hand washing, like physical distancing, and we should really look and explore how do we partner with local public health officials, with different community organizations who may have a greater reach or may have trust within various worker populations. And finally, we have a treatment pillar. And with this, there needs to be a policy, a paid sick leave policy within workplaces so that workers don't have to make the choice between coming to work sick and being able to put food on their table. We need to make sure that there's accessible and free COVID-19 testing in communities, and we need to provide health care to those who do test positive. In workplace safety and health, we like to use a framework called the hierarchy of controls, which you can see on this slide. It has 5 different levels. The first one is elimination, which refers to physically removing the hazard. In the case of COVID-19, this is not possible. The next level is substitution. Again, this is not possible with COVID-19. The third level refers to engineering controls and figuring out ways that you can isolate the hazards within the workplace. So this refers to physical changes that can be made to the work environment. In the case of meatpacking, we might think of plastic barriers between workers or spreading people out farther on the line, so putting more distance, physical distance between people. The next level refers to administrative controls and practices. This might include things like having a paid sick leave policy or instituting a universal mask policy. And finally, at the bottom, you'll see personal protective equipment. So we should not be using personal protective equipment or active screening procedures to replace or substitute some of the more substantive changes and actions that should be taken within the workplace environment. On this slide, you'll see a number of recommendations that we make based on the results of the meatpacking plant worker study. So under engineering controls, we feel it's very important to ensure the appropriate social distancing strategies on the line, but also in those common areas throughout the plant. In terms of administrative controls, we think it's very important for workers to be able to have paid sick leave benefits and to communicate these paid sick leave policies throughout the workforce. We feel that sometimes that information isn't being shared to all levels of the organization. We feel that it's important that supervisors really lead by example and promote the health and well-being and safety of their teams. And it's important also to enhance the training opportunities for workers, especially around how to properly use and care for a mask, sanitation guidelines, and the return to work policies. In terms of PPE, one of the major things that we think would be beneficial is ensuring that all workers have access to more than one mask per day so that they can change them as needed throughout their shift. And finally, in terms of education, of course, we need culturally, linguistically appropriate information on COVID-19 and how to stop the transmission. We also need to inform workers about the contact tracing procedures and process that are instituted by the plant and partner with those agencies in the community and with the local public health department to really do outreach and education with the workforce. And finally, we need to establish a coalition of organizations that can help families, workers' families, to be able to respond in times of need. At the University of Nebraska Medical Center, we've developed a number of resources to assist workers and the industry with dealing with COVID-19. For workers, we've created multilingual flyers, educational flyers, which are available in English, Spanish, Arabic, Vietnamese, and French. They talk about ways that a worker can stay safe in the work environment, and then it also gives strategies for how to stay safe when you're outside of work. These are available online at the link on the slide. We've also created an industry playbook for meat processing facility leadership to understand what are some of the engineering controls, administrative controls and practices, and personal protective equipment that should be used within the plants. Conducting research is not just about the study itself. It's about ensuring that the study is relevant, timely, and actionable. So to that end, you need to have a plan for how you're going to disseminate the results of the study and the findings that you have. In our case, in the case of this meatpacking plant worker study, we've done a number of things to share information back with communities. For example, I have shared the results of this study on a call with the governor and all of the meat processing facility leadership in the state of Nebraska. I've developed a PowerPoint with the key study findings for all of our partner organizations so that they can give that information and further disseminate the findings. We've created a one-page overview of the key study findings and recommendations that was disseminated to partners. It's available in English and Spanish, and it's also online. We made that available within 1 week of closing the survey, so we worked hard and fast because of the timely nature of this study to make sure that people had information right away. I've also conducted a number of presentations with stakeholders all across our Midwestern region, from a bilingual connectors group to a coalition of faith communities to university partners. I've done a number of media interviews with newspapers and with filmmakers as well. And finally, our team has submitted manuscripts for peer-reviewed publication. I urge you to think long and hard about what are the key messages that people need to take away from your study and how you're going to be able to get that information back to the partners that work so hard to help you to be able to collect that data. This study and the results from the study are being used already right now. For example, they're being used by worker advocacy organizations to promote safer working conditions and employee benefits for all meatpacking plant workers. They're being used by legal advocates and attorneys to use the law to enforce safety regulations and promote worker protections in the plants. They're being used by safety consultants to improve infection control practices. And finally, some of the questions from the survey and part of the design of the study are actually being used by NIOSH, the National Institute for Occupational Safety and Health, to provide and frame some of the technical assistance that they are giving to the plants and to develop additional research and surveillance activities. This is a perfect example of teamwork. A study like this would not have been possible without the help of a lot of people and organizations. So it's only fair that we acknowledge their contributions to this study. First, we'd like to thank all the workers who participated, who gave of their time in completing the survey, which took at least 15 minutes, if not longer, to be able to complete. We hope that their comments, their concerns, their perspectives are going to be listened to and that they will lead to action to improve the working environments in these meatpacking facilities. We'd also like to acknowledge the help of the following organizations: Heartland Workers Center, Latino Center of the Midlands, Nebraska Appleseed, Nebraska Migrant Education Program, the Rural Community Workers Alliance, and the Central State Center for Agricultural Safety and Health. Without them, disseminating a survey like this would have been very challenging, and they made sure to share the information with all of the people that they come into contact with. And actually, some of them have put it on social media. They paid for boosted posts through their pages on social media, and they really did a good job of making sure that workers who had limited English proficiency or limited computer literacy had resources to be able to complete the survey with them. And finally, I'd like to thank the UNMC Global Center for Health Security for their leadership in promoting best practices in infection control and prevention procedures for Nebraska and for the meat processing industry. And their recommendations are what helped to guide the development of the key study question around employer responses. And so I thank them for that. What you've just heard is an example of real science with a real world problem. We saw the situation, we heard from partners and from stakeholders about the importance of addressing this issue. And because this was such a timely issue, we needed to mobilize fast. We needed to work with partners to be able to do this in a way that was going to produce actionable results and information so that they can take this information and be able to advocate for safer and healthier conditions for workers. So what I'd like for you to do now is to take a moment and reflect on what I've shared with you today in this example from the meatpacking plant industry. And what would be two key takeaways about community engaged research that you're walking away from this presentation with, and why are those important for you? I'd like for you to think, if you had been in my situation, if you had been the researcher, what would you have done differently and why? And finally, knowing that sometimes these research opportunities arise in moments of need and the responses have to be rapid, what would you do to be able to prepare, to be able to engage in research during this type of situation? I hope that this example of community engaged research with meat processing facility workers has been a valuable learning experience for you. I believe that there's a number of key takeaways from this study that can be transferred to community engaged research generally. And I'd encourage you to continue to think about those things and how you can use the lessons that you hear about from other people's study to further your research and your skills in working with communities. On this slide, you'll see my contact information. Please feel free to reach out to me via email. If you have any further questions, I'd love to talk with you more about what's going on in meat processing facilities, how this research has been used, and provide you any guidance that you may need in developing community engaged strategies. So thank you so much for your time, for your attention.